Hello, and welcome to The Science of Healthy Weight Loss with Dr. Stanley K. Bernstein, a podcast that will demystify, deconstruct, and detail the journey to healthy weight loss and a healthier you. Dr. Bernstein has made it his life work to study the science of healthy weight loss. Over the past 50 years, he's helped hundreds of thousands of people lose millions of pounds of excess weight and restore their health. Through his methods, his patients can lose up to 20 pounds every month, improve their associated medical problems, and even get some people off their medications altogether. Our series examines all the angles of losing weight properly, how the science works, the health benefits, why support is so important, how to keep those pounds from creeping back on, and much more. We thank you for joining us. Now, let's start losing weight. On this episode, we'll examine the benefits of healthy weight loss, starting with identifying health issues and medical problems that are further impacted by being overweight. We'll explore how losing weight in a medically supervised manner can be beneficial to existing medical problems, and we'll take that one a step further and hear some remarkable examples from Dr. Bernstein about patients whose health improved dramatically once they lost those excess pounds. All this and more on this episode of The Science of Healthy Weight Loss. There are all sorts of reasons for wanting to lose weight. A big motivation is wanting to look thinner, to fit into clothes more comfortably, to not be so self-conscious, and to like what we see in the mirror. But another, more impactful reason is our health. We know that excess weight increases our chances of developing many types of cancer, also related to excess weight and poor diet, coronary heart disease, high blood pressure, diabetes, arthritis, irritable bowel syndrome, hip and knee issues, gallbladder problems, sleep apnea. The list of all the conditions and diseases made worse or even caused by carrying extra pounds is enormous. How does extra weight compromise our health so easily? Well, you may recall on our previous episode, Dr. Stanley Bernstein explained that in a balanced system, our body turns the food we eat into glucose, then moves it into our cells for energy. If we eat too much food, too much glucose is created, and our body takes the extra glucose and stores it. Most of it is stored in fat cells, and these molecules are available as an energy source when we are on a calorie-restricted diet. Now, excess fat, as it flows through the bloodstream, causes high blood cholesterol levels. This cholesterol can accumulate on the walls of arteries and blood vessels, causing plaques, which restrict blood flow. Because of the restricted blood flow, the heart has to work harder to move blood through the body, which can lead to high blood pressure. In addition, the accumulated plaques on the artery and vein walls cause them to harden, making the blood vessel walls more susceptible to tearing internally or totally, which can cause an aneurysm or massive internal bleeding, leading to heart attack, stroke, or death. The long and short of it is, if we are overweight and not doing anything about it, we could develop serious health problems. But Dr. Bernstein stresses that you can significantly improve these conditions or even turn them around completely with healthy weight loss. Let's go over some of the health issues that are compromised by being overweight and why and how weight loss will improve these conditions, starting with diabetes. Diabetes is a chronic health condition that affects how your body manages carbohydrate metabolism. According to Statistics Canada, more than 2 million Canadians reported being diagnosed with diabetes. So how does Dr. Bernstein approach someone with diabetes?
They're overweight, they're diabetic, and their blood sugar management is out of control. They're not taking enough medications, they're eating too much of the wrong foods, and their blood sugars are too high and they're running into complications of diabetes. Almost every one of our type 2 diabetics who has lost weight with us will stop all medications, they won't need it anymore, and they do not have clinical diabetes anymore. Type 1 diabetics, which are juvenile diabetics, they're born with diabetes, are not in good control if they're overweight. And as they lose weight with us, their blood sugars do drop into good management levels. We can reduce their diabetic medication significantly so that control becomes much easier and healthier for them.
So with healthy weight loss and managing healthy weight, the potential for diabetes to be better controlled or even eliminated is a reality. What about coronary disease, which affects about 1 in 12 Canadians over the age of 12? Coronary disease is the narrowing or blockage of the coronary arteries, which are the blood vessels that carry blood and oxygen to the heart. Dr. Bernstein says it, too, can be dramatically improved with healthy weight loss.
The diet that I use will help improve your coronary blood vessel circulation. Cardiologists have told their patient that they have to lose weight and then they have to go through surgery for their coronary vessels to put a stent or 2 stents in to improve their heart circulation. They've done angiograms and seen significant blockage of blood vessels. Patients have come to us to lose weight. After they've lost a good chunk of weight with us, 30, 50, 100, whatever the number's been, 100 pounds, they have better exercise tolerance, etc. The cardiologist has done second angiograms and found the blood vessels improved dramatically to the point where they do not need surgery. So we have helped cancel coronary surgery on every patient who has lost a significant amount of weight with us. We send them blood requisitions that they have to go to the lab and get the blood done that we want periodically. We'll send them out for further testing, such as a chest x-ray or electrocardiogram or liver function tests. And we get patients who, being overweight, have fatty liver disease. They've stored a lot of fat in the liver, and that damages their liver cells that can create serious problems as they get older.
Let's talk about knee and hip replacements. How many people in your circle have been told they need a hip or knee replacement surgery? And out of those people, how many are carrying around extra weight? Dr. Bernstein says those issues, in most cases he's seen, can be fixed up as well with healthy weight loss.
When we talk about arthritis, imagine if you're carrying 50, 100 pounds extra or more, your bones and joints feel it. And patients develop arthritis in the weight-bearing joints, like knees, hips, back area, from carrying so much weight and putting the stress on for years. We have had patients who have been advised that they need a hip or a knee replacement because bad arthritis in the hip or knee is causing pain and disability. The doctors have told these patients, you're overweight, and if you go through the surgery of replacing a hip or a knee, you've got to get into an exercise regime, and so you have to lose weight or they won't do the surgery. Patients have come to us to lose weight. Almost every patient that has been sent to us to lose weight for a hip or a knee replacement or back surgery, by the time we are done with that patient, we have canceled almost every single surgery.
With the extra weight off, the joint improves dramatically and the need for surgery is re-examined. Dr. Bernstein says the patients might have to take acetaminophen once in a while, but surgery is off the table. Dr. Bernstein recalls a story in which 2 patients were booked for knee replacement. They were getting physiotherapy leading up to their surgery. They lost weight, and both ended up canceling the surgery. Dr. Bernstein takes it from here.
The physiatrist who was treating these patients called me and asked what did we do to help them lose the weight. I explained our program to her and told her that we've done this for years. We decided to do a medical study, and the hospital sent us 35 patients who needed knee replacements done, who were overweight, and we put them on our program, took their excess weight off, and we canceled the knee replacement on 34 of the patients. The one patient was hit by a car, and so that one did have to be replaced. But the arthritic and weight-bearing problems, all of those knees, they did not have to do any surgery with them at all. And this story has repeated itself over many, many years.
We've covered diabetes, coronary disease, arthritis, all conditions that can be dramatically improved, even cured, by healthy weight loss and weight management. What about our stomach and bodily functions? Yep, Dr. Bernstein says if you have digestive issues like heartburn or IBS, those too can be dramatically improved.
Another nice effect of eating sensibly and burning fat up properly. Their pancreas works well, their digestive systems work well, the amount of digestive juices that are released into the stomach to help break food down and absorb it work well and get back to normal. And so most bowel irritating symptoms get improved.
Meaning the patients no longer need antacid or antispasmodic medications. And the health benefits of eating properly and losing those extra pounds are not just limited to the adult population. There are a lot of overweight kids and teens out there. It may be just extra weight now, but if they or their parents or guardians aren't on this, it will eventually turn into some of the health issues we just spoke of. Dr. Bernstein weighs in.
The sooner you get people to lose weight, the healthier they will be for the rest of their life, and the fewer complications there will be. We treat kids now because it's very important to start the treatment early. We've had 8-year-olds, teenagers, lose a large amount of weight. The average female who's 5'4", for instance, should be between 120 and 130 pounds. And we know if they're into the 150 area, we know they're overweight. We know they're carrying too much fat. They can see it in their waist and hip areas, their thigh areas. And her blood sugar may be normal. She's not got arthritis. She's not having symptoms. We know that if she stays at that extra 25 plus pounds, she will be developing symptoms as she gets older. And if they're cardiac symptoms, they're going to be more serious than if they're just a little pain in the joint type of area. And yes, if they're carrying more than 25 pounds, like 50 or more pounds, they will get the complications earlier in their life. You don't see too many obese 80 or 90-year-olds walking around. That's the reality of carrying too much weight.
Dr. Bernstein wants us to get to 80 or 90 years of age and still be mobile and healthy. And that requires taking a good, hard look at our health today so our future self will thank us.
We have not had a patient that I could not treat. And we've treated over 750,000 patients. The only time I've turned someone away, by the way, is a woman who's missed her period by a few days or a month. I won't treat them until I know whether they're pregnant or not. So if we know they're pregnant, I'll put them on our maintenance diet so they're eating on a healthier basis and they can lose a little bit of weight and have enough nutrition for themselves and the baby to grow on. Or they may want to wait till after the delivery and then they'll come to us and take it off in a hurry. But we do want to make sure they don't gain too much during the pregnancy also, because that's unhealthy for the baby. So we will use our maintenance on a short-term basis and then get into the real weight loss program after they've delivered.
It's so easy to give into those cravings when you're pregnant. There's a very good chance whipped cream and pickles is not on Dr. Bernstein's plan, and rightly so. There are so many health benefits to losing that extra weight, getting off medication, having more energy and vitality, and long-range growing old and staying vibrant.
Oh, very definitely. When you lose all of your excess weight, or almost all of it, and you increase your body metabolism and you improve the comorbid diseases, there are many studies showing that you can add a good 10 to 20 healthy years to someone's lifespan. And one of the motivating factors I have with patients, I tell them, lose your 50, 80, 100 pounds, and you'll be around to see your grandchildren and play with them, and you'll avoid the potential of a stroke or heart attack, and first you'll live longer, but you'll live healthier. That's a very good motivating factor for patients.
And for those who live with sleep apnea and need a CPAP, yep, if you lose that extra weight, there's a good chance that you lose that machine too. Dr. Bernstein explains.
Patients that are overweight who can't use their lungs properly and they can't expand their lungs because there's too much fat stored in their abdomen, they can't expand their lungs properly while they're sleeping, they need the assistance of some oxygen. So they're wearing an oxygen mask all night long to help them breathe properly. And some patients are wearing an oxygen mask throughout the day as well. Some of these patients need a CPAP for repeated respiratory infections, and some need it because of their obesity situation. When we treat these patients and they lose their weight, their lungs move far more efficiently, almost back to a normal level, and they no longer need this CPAP machine. Every single patient we have treated who uses a CPAP machine when they walk in the door, we've been able to stop using that machine because their breathing is back to normal.
A dramatic improvement on health conditions, our sense of well-being, quality of life, and even quantity of life. Those are the benefits of healthy weight loss, not to mention feeling more comfortable in those clothes. So now that we know a healthy weight loss and maintaining a healthy weight is hugely beneficial, let's talk about the weight loss itself and doing it in a medically supervised way that ensures your body is losing those pounds safely. Dr. Bernstein weighs in.
Yes, we try to teach our patients to eat properly, how to eat regular food, the right type of foods. We want them to eat properly for the rest of their life and to get used to portion control while they're doing the program. We're monitoring them through the weight loss. They learn to prepare their foods properly. They learn to, say, have a piece of chicken breast that the fat's been taken off, the skin's been taken off before they cook it. They don't use any oils in the cooking, and we teach them how to weigh their food, and they can end up eating that way for the rest of their life. So portion control becomes easier for them when they learn to do it during their weight loss program. We have patients keep a food diary. Our nurses and physicians who are monitoring the patient will see what they're eating, the amounts and portions that they record it, so that we can make adjustments as necessary, and we make sure they're drinking enough liquids every day, and we are very specific with what real foods they can eat and what they should not be eating.
A program that uses real food, portion control, education, medical supervision without any diet pills or herbal potions or magical miracle cures. There are so many benefits of healthy weight loss with Dr. Bernstein's team, who are looking forward to helping you help yourself every step of the way. So, what have you got to lose? To learn more about all the benefits of healthy weight loss, visit www.drbdiet.com. That's drbdiet.com. Dr. Bernstein would also love to hear from you. Email him at podcasts@drbdiet.com. That's it for this episode of The Science of Healthy Weight Loss with Dr. Stanley K. Bernstein. Thanks for listening. Stay healthy, and we'll talk to you in episode 3.